Hello friends, once again welcome to my channel. Today we are going to discuss the central nervous system pathology, an important disorder that is Alzheimer's disease. In the previous videos, we were discussed about multiple sclerosis and Parkinson's disease. As a continuation, today we are talking about another degenerative disorder that is Alzheimer's disease. Let us start with the definition. Alzheimer's disease. It is an insidious, progressive, degenerative disorder of the neuron. Insidious, that means slow, harmful. Progressive, that means that once the disease affected, it is continuous and there is no way to stop its progression. That is progressive. And degenerative, that is, the degenerative means it is characterized by a progressive deterioration and loss of function in the organ or tissue, that is in the brain cells. So the definition is insidious, progressive, degenerative disease of the neuron. Now let's see what is happening here in Alzheimer's disease. Alzheimer's start from the hippocampus. Hippocampus is important for making new memories. Later, it affects the areas in the cerebral cortex responsible for language, reasoning, and social behavior. Eventually, many other areas of the brain are damaged. Over time, a person with Alzheimer's gradually loses his or her ability to live and function independently. Ultimately, the disease causes death. Common cause of death is recurrent infection due to aspiration pneumonia, and the other cause is dehydration because the patient is getting bedridden and forget to take food and fluid. The disease progress is associated with accumulation of senile plaques and neurofibrillary tangles in the brain. The senile plaques is composed of amyloid beta proteins and the neurofibrillary tangle is composed of tau protein. How is the senile plaques formed? Let us see it. In Alzheimer's disease, accumulation of amyloid plaques between nerve cells is occur in the brain. Amyloid is a general term for protein fragment that the body produces normally. Beta amyloids is a fragment of a protein snipped from another protein called amyloid precursor protein or APP. In a healthy brain, these protein fragments would break down and be eliminated. In Alzheimer's disease, the fragments accumulate to form plaques that are the senile plaques. Neurofibrillary tangles. These are insoluble twisted fibers found inside the brain's nerve cells. They primarily consist of a protein called tau, which forms a part of structure called microtubule. The microtubule helps transport nutrients and other important substances from one part of the nerve cell to another. Axons are long thread-like extensions that conduct nerve impulses away from the nerve cell. Dendrites are the short branched thread-like extensions that conduct nerve impulse towards the nerve cell body. In Alzheimer's disease, the tau protein is abnormal, the microtubule structure getting collapsed. As Alzheimer's disease progresses, the brain tissue shrinks. However, the ventricles are noticeably enlarged. In the early stages of Alzheimer's disease, short-term memory begins to decline when the cells in the hippocampus degenerate. Those with the disease lose the ability to perform routine tasks. As Alzheimer's disease spread through the cerebral cortex, that is the outer layer of the brain, judgment worsen, emotional outbursts may occur, and language is impaired. Advancement of the disease leads to the death of more nerve cells and subsequent change in behavior such as wandering and agitation. In the final stage, people may lose the ability to feed themselves, speak, recognize people, and control bodily functions. Memory worsen and may become almost non existent. Constant care is typically necessary. On an average, those with Alzheimer's lives for 8 to 10 years after diagnosis. But this terminal disease can also last for as long as 20 years. The signs and symptoms of the Alzheimer's disease progress with the plaques and tangles build up. Here we are discussing the seven stages of Alzheimer's. They are stage 1, that is normal, stage 2, normal aged forgetfulness, stage 3, mild cognitive impairment, stage 4, mild Alzheimer's, stage 5, moderate Alzheimer's disease, stage 6, moderately severe Alzheimer's disease, and the last stage 7 is the severe Alzheimer's disease. In stage 1, there is no impairment. During this stage, Alzheimer's is not detectable and no memory problems or other symptoms of dementia are evident. Stage 2, very mild decline. The patient may notice minor memory problems or lose things around the house, although where the memory loss can easily be distinguished from normal age related memory loss. The person will still do well on memory test and the disease is unlikely to be detected by loved one or physician. Stage 3, mild decline. The family members and friends of the patient may begin to notice cognitive problems. Performance on memory tests are affected and the physician will be able to detect impaired cognitive function. People in stage 3 will have difficulty in many areas including finding the right word during conversation, organizing and planning, remembering names, new acquaintances. People with stage 3 Alzheimer's may also frequently lose personal possessions, including valuables. Stage 4, moderate decline. In this stage, clear cut symptoms of the disease are apparent. People with the stage 4 Alzheimer's having difficulty with simple arithmetic, have poor short term memory, example, may not recall what they ate for their breakfast, then inability to manage finance and pay bills. Stage 5, moderately severe decline. During the fifth stage of Alzheimer's disease, people begin to need help with many day-to-day activities. People in this stage may experience difficulty in dressing appropriately, inability to recall simple details about themselves such as their own phone number, significant confusion. On the other hand, people in this stage they typically can still bath and toilet independently. They also usually still know their family members and some details about their personal histories, especially their childhood and youth. Stage 6, severe decline. People with the sixth stage of Alzheimer's disease need constant supervision and frequently require professional care. The symptoms include confusion on unawareness of the environment and surroundings, inability to recognize face except for the closest friends and relatives, inability to remember most details of the personal history, loss of bladder and bowel control, major personality changes and potential behavior problems, the need for assistance with activities of daily living such as toileting and bathing. Then the last stage of Alzheimer's, that is stage 7, very severe decline. Stage 7 is the final stage of Alzheimer's because the disease is terminal illness. People in this stage 7 are rearing death. In stage 7 of the disease, people lose ability to communicate or respond to their environment, may be still able to utter words and phrases. They have no insight and need assistance with all activities of daily living. In the final stage of Alzheimer's, people may lose their ability to swallow. These are the signs and symptoms of Alzheimer's disease in different stages. We can memorize these signs and symptoms together for the exam purpose with a 5A. Let us discuss it. Amnesia, anomia, agnosia, apraxia, and aphasia. These are the 5A's of dementia or Alzheimer's disease. Aphasia, difficulty with language. The patient is not able to communicate properly. So try to speak slowly. Remember that the patient may not understand the words that you're saying mean or be able to easily form an appropriate response. So speak slowly and allow the person with the Alzheimer's longer to reply. Agnosia. It is the inability to recognize the object. Agnosia, recognize. The word, there is similarity. So we can remember easily, that is agnosia, recognize. Not able to recognize the objects. So try to pointing to the object and demonstrating how to use it can be helpful for the patient. Apraxia, inability in movement, forgetting how to do common movement and activities when asked. Remember that they will be unable to perform the task you are requesting, even though it is something they have been doing for years. Amnesia, simply we can see loss of memory, forgetting what you said within a short amount of time. Don't ask the patient with Alzheimer's to do something and then leave the room or get busy with something else. They may get distracted and forget what you said. Instead, stay close and provide gentle reminders and supervision as needed. Only give one instruction at a time. Anomia, difficulty with word finding. Remember that it will take longer for the person with Alzheimer's to find words, to form sentence or reply to questions. Be patient and don't expect immediate replies. These are the 5 A's of Alzheimer's disease. Remember these 5 A's. This will helpful for your exam as well as to communicating with the Alzheimer's patient. They are amnesia, anomia, agnosia, apraxia, and aphasia. Mini mental status examination, CT scan, and MRI are the major diagnostic tests for this Alzheimer's disease. Now let's see the treatment that we are given for this Alzheimer's disease. Treatment is aimed at reducing the process of destruction and improve the quality of life only. There are two treatment choices for Alzheimer's. They are cholinesterase inhibitors and NMDA antagonist. Cholinesterase inhibitor prevent the breakdown of acetylcholine in the brain, and NMDA antagonist block the toxic effect associated with excess glutamate, and it regulate glutamate activation. Activation of synaptic NMDA receptors initiate plasticity and stimulate cell survival. In contrast, the activation of extrasynaptic NMDA receptors promote cell death and to contribute to the etiology of Alzheimer's disease, which can be blocked by Alzheimer's drug memantine, and is an NMDA receptor antagonist that selectively block the function of extrasynaptic NMDA receptors. The cholinesterase inhibitors are prescribed for mild to moderate Alzheimer's disease. These drugs may help to reduce some symptoms and help control some behavioral symptoms. Example for the anticholinesterase medication are galantamine and rivastigmine. I hope you got all these points regarding Alzheimer's disease, especially the 5 A's of Alzheimer's and management of Alzheimer's patient. So, thank you. Thanks for watching. If you are not subscribed my channel, please subscribe it and share it to your friends so that we can grow together.